It was a partnership not, seen before, as far as my experience is concerned. We built the partnership right from, the foundation level by way of engaging ourselves across the entire stakeholders, membership. We tried to understand the basic issues on ground, and of course, we came up with the concept, the design, and the processes of doing the actual work. So it was that kind of approach that actually brought all the partnership together, and it made things so easy in terms of moving forward, because we all had equal stake, equal understanding in terms of starting the project and the continued implementation. And that's why I think it's not surprising that we're able to get this far in terms of the positive achievements we've achieved, and everybody is living very happy. The funders, the government agency, the implementing partners, ideas, PACT and SFH. We operated in a very collaborative, very integrated way. Ideas was responsible for the data, which helped us to make informed decisions. It was quite crucial that at regular intervals, Ideas was helping us to collect and analyze data. And we're able to see and track, all the milestones, all the development, all through. And we're able to change course and, ensure that the project, remain inside and in focus, and very focused to achieving those desired results that we saw coming out, as outcomes. It was quite critical. And of course, in terms of my role as the pioneer sitting executive secretary, I was kind of leading, providing, that enabling environment for all the fund, the partners, the funder, and everyone to be able to operate, without any inhibition, because it was an equal stake kind of thing. So quite collaborative, and we ensured that all the partners were very happy working with us. If I'm to advise states that would come in to copy this kind of intervention, they need to also have that kind of foundation from the beginning. And the government needs to take the lead role. It's only fair that the government that is, superintending over the people and the system are in charge of running the affairs. And then the partners are there to technically backstop and support the entire intervention. So that ownership is key, and not just at the level of the government or the agency that is responsible for the implementation, but down into the community. You saw how we work very closely with the development committees. All the gatekeepers were part of the entire process. Healthcare workers were there. So everyone had a stake. And so that's how it all happened. And for any state that is venturing into this kind of intervention, I think it's strong. It's a good thing to learn this, pick up from where we've stopped and implement those key issues and key lessons.